we are all isolating ourselves, and we are in this quarantine time right now. Um, we're not leaving the house. There are a lot of people, those who are staying at home, except for the ones those who really have to go work. We're not meeting other people. Nobody knew. We're all at home. Will we? What are the chances for the people, those who are sheltered in place and not leaving their house, to catch this, to get this?
I mean, this can be transmitted only by contact. So even if you before you went into self-isolation, uh, if you already, had a contact with a positive person, then it's too late. So even if you quarantined, you still would get it. So that you would know in about 10 to 14 days. So that's one of the reasons why they quarantine you for 10 to 14 days. So if you have the infection, by then you would know.
If I have some kind of symptoms within this 14 days, but I'm not diagnosed for this, should I still quarantine myself away, or what do I have to do?
Yeah, so that's why I was saying the latest CDC recommendation is that if somebody shows any of the symptoms and if you're quarantined, the question is, when do you get back to work? The latest CDC recommendation is if you're past 7 days from the start of the first day of infection, and if you're past 7 days, you can pretty much go back to work. That is the latest recommendation by CDC. And most of these things, we follow this, Center for Disease Control, CDC recommendations.
If somebody has been infected, we don't know, we have not been diagnosed, but somebody is sick, coughing, maybe they have fever, but they have not been diagnosed. How do anybody else take care of the sick person?
Like I said, ideally, I think, anyone who's got any symptoms should be tested. But unfortunately, at this day and age, we cannot do that because of the shortage of kits. And so they have been very, very selective. So CDC had made certain recommendation to be qualified to be, to have the test done. And if you don't have, don't qualify, you just don't get it. They won't do your test. The typical example would be, if you're a doctor, if you've got cough, cold, and a little bit of fever, they wouldn't do the test. They would just say, go home and, rest. Right now, the high-risk population that they were doing the test was people who have gone to China, Italy, Iran, South Korea. If anyone came back from any of these countries, they would do it. The second group of people that they would do it is anyone who was in very close contact with somebody who was diagnosed to be positive. And that I would say mostly like a spouse. If one of the spouses was detected to be positive, definitely the partner should be tested, because even that close contact, what they say is anything that is more than 15 minutes. So casually you go to a bank and the banker, probably the teller had coronavirus, transmission is very, very unlikely unless you transmit through the formite. So you need, according to CDC, their number. If you have contact, if you have sat together for more than 15 minutes, yes. And the second thing is, even if somebody was coughing and was positive, they say that as long as you have at a distance of 3 meters or 6 feet, 2 meters or 6 feet, you are pretty safe. Because when somebody coughs, the droplet apparently doesn't reach 6 feet. So that's why they say that always keep a safe distance of 6 feet in this infection.